So today, welcome. My name is Lyle Murphy. I'm the founder of the Alternative to Med Center. And it is my great privilege to be interviewing for this podcast, Dr. Shiva Lalezar. She is a functional medicine doctor in the Los Angeles area. And we're always looking for the brightest minds in the field that we can interview. And so we go seeking out these people, and we've got Dr. Shiva, and we're very privileged to have her on our show today. So, Dr. Shiva, would you like to tell us a little bit about what you do and what your medicine approach is, and the type of clientele you treat, and wherever you want to go with telling us about yourself?
Sure, Lyle. First of all, thank you so much for inviting me on this podcast. I'm honored. I have been very privileged because when I was young and I wasn't even in medical school, I had an amazing mentor who started teaching me nutritional medicine and functional medicine before I even went into medical school. I was only 18. So I was exposed to this type of medicine from a very, very young age. I then did a conventional training and finished medical school, which was a 4-year training after my bachelor's in biology from UCLA. And then after medical school, I went to Medical College of Wisconsin for a family medicine residency. So I've also studied osteopathic medicine and Reiki and spiritual psychology. So I try to combine all of that with my degree in chelation therapy. I'm certified in chelation therapy and certified in functional medicine. So I've been practicing this type of medicine for over 20 years, and I'm actually thrilled and so happy to be able to do this type of investigative work on patients who've had and have suffered with chronic illness and have been to multiple doctors and multiple specialists, and they come to my office and we try to get to the root cause of the problem.
Nice. Well, you might know this about me, but my educational tract was chiropractic. And I like the osteopathic profession because they, they've held a certain trueness and the, belief that the healing comes from within, and that the power of the innate is really the healing entity of the body, and that medicine is meant to work behind that, not in front of it. So,
absolutely,
do definitely appreciate that. Now, what type of patients do you normally get? Who normally walks into your office and says, "Hey, I need some help"?
I get a lot of patients with vague symptoms that nobody can pinpoint. They're sort of like in this gray zone. So I'm going to explain a concept that I like in functional medicine, is that we have this health spectrum. So this is where we're really, really healthy and vital. And this is when we are really, really ill. So when we go to a conventional doctor, they'll be able to figure out what type of illness, and they'll give you a diagnosis, right? Through blood tests or through symptomology, through CT scans. So that's when we're really ill. But there is an area of health that's actually really not that healthy. It's right in the middle, which I call the gray zone. And these are patients who cannot pinpoint exactly what's wrong with them. All their blood test is normal. Doctors quite often tell them, "Oh, it's all in your head." But they're really ill and they can't even get out of bed. So these are the type of patients that come to my practice. Now, it could be chronic fatigue, fibromyalgia, chronic prostatitis. It could be hypertension that's not responding to medication. It could be uncontrolled diabetes. It could be anything. I know my friends make fun of me. They're like, "What type of specialist are you?" When you start practicing functional medicine, you have to know a little bit from every specialty. I'm also honored because I refer to a lot of specialists in the area, and they refer back to me, so that we can both work together to get to the root cause of the problem of these patients. Does that kind of answer your question?
Yeah. And, I tend to get people here when they are pretty much abandoned by their doctor. The doctor gets to a point where they just don't know what to do with them. The psychiatric medications aren't working anymore. It would, I consider functional medicine to be, you know, really on the top of the heap, right up with environmental medicine as far as the just different skill sets you have to be able to understand in order to be able to practice in that realm. When I'm doing outside patient referrals and I'm looking for a doctor in a person's area, which to me is a very large component of my work, you know, not just anyone can come here. They have to have the resources. So trying to find them the resources in their area can be challenging depending on where they are. And the first database I go to is the IFM to look for a functional medicine doctor in their area, because I know by and large, even if I don't have a working relationship with that doctor, it's a good starting point for me to call and say, hey, you know, can you handle this type of patient? Because ours are very, very compromised when they come here, and they go through such an evolutionary leap to get back in the saddle that I don't want somebody to mess it up and take them down, you know, the over-medicating road again. So you've been one of our light posts out there, you know, to guide people back to, and the people in your area, it's like, oh, go see Dr. Shiva. So thank you for being that.
Thank you for the referral.
How about mental health? Do you really, do you see people that are suffering from anxiety and depression and even some affective disorders and mania psychosis that that you work with?
The majority of yes, I actually would say that the majority of, can you hear me?
It just cut out for a minute, so if you could repeat that.
Sure. So the majority of my patients have psychiatric issues, depression, anxiety, drug addiction. And the reason for that is because they are so unwell physiologically that they develop psychiatric issues.
Right.
You see that? Or it could be the other way around. We are never going to know which came first, the chicken or the egg. You know, was it the psychiatric issue that caused all these physiologic problems? To me, it doesn't make any difference, because I want to treat their psychiatric issues at the same time I am balancing out their physiology. And I actually think it's a crime to diagnose anyone with anxiety, depression, bipolar, if we have not done a full physiologic workup on them. And if we have not removed heavy metals out of their system.
And you know that never happens, especially in emergency psych. They don't even typically run.
It never happens.
I mean, you're right about the lab tests. When you see something on a radiograph or you see something on a conventional lab test, usually something's really wrong by that point. And what I've noticed in mental health, I mean, obviously there's not this, I mean, there is a blood-brain barrier, but this part is still connected to this part. So when we're talking about physical health, it's of course going to share the same, it's in the same physiological being. It's going to affect your mental health as well. And a very small amount of chemical change, like if someone takes a microdose of LSD, it produces a profound mental change. And a lot of these chemicals, a lot of these hormone mimickers, a lot of these xenobiotics and things that may not have a psychoactive effect are still messing with our chemistry in a certain way that change the way that we think and feel and the way that we are able to operate mentally. Oftentimes, even before you see physical symptoms, to me, the mental health symptoms are actually clues. They're actually ways to hone in on, like, there's some problems happening here. It's like the early warning system for a person to say, I need help.
Right. So, for instance, one hit of cocaine can cause 52 hours of oxidation in the brain. So you can imagine what type of damage these drugs can do to the biochemistry of the brain, causing an imbalance between serotonin, GABA, norepinephrine, and epinephrine.
Yep.
So clearly, when we mess up with the balance of these neurotransmitters, we are going to have psychiatric issues. You see? whether it would be mood elevation or mania, or it would be depression, or it would be severe anxiety. When we are messing with the biochemistry of the brain, we are causing the symptoms. The symptoms are a side effect of what has already happened in the brain. So the art of medicine is, how are we going to bring balance to all these biochemicals or the neurotransmitters in the brain? How are we going to get rid of the junk in the brain and clean up the brain and stop the oxidation that's going on? How are we going to do that?
Yeah, like there's a lot of marketing behind the drug thing. It's quite an easy platform to make money from. It's a lot more challenging to make money from, being intuitive about what a person's real symptomatology is. And to me, it should be obvious. The drugs need liver enzymes to be able to clear them from your system. Your body is treating them as a poison, is metabolizing them as a poison. And physiologically, many of the drugs are acting as a poison. A SSRI does not create serotonin. It poisons the serotoninase enzyme so that it can't be reuptaken. And that's sort of a conservative process. You express serotonin, it's used at the at the synapse, and then it's pulled back into the vesicle so it can be used again. Well, it just forces it to stay out there by poisoning an enzyme, and then it breaks down into its metabolites, and there's absolutely no serotonin left. So just like cocaine will burn up dopamine, if you do enough coke, eventually it stops working. A lot of these drugs operate the same way. And to me, it's kind of analogous to trying to stand a broomstick up in the middle of a hurricane. You try to push with a drug, you just try to push the physiology in another direction, hoping it doesn't tip all the way back over the other way. But as soon as the wind blows from another direction, it just all falls apart. Building up a person's system and actually planting that broomstick in the ground and putting some concrete around it is a way to get it to stand up straight. And that happens through building up the physiology naturally.
Absolutely. There are actually a lot of ways that we can balance out the neurotransmitters in the brain.
Yeah. And where's that coming from naturally? Like most food that's available to us, even stuff that's grown, even if you're eating fruits and vegetables, that's being grown on soil that's demineralized. They found a can of spinach from the 30s and did a assay on it and found that it had 40 times the amount of magnesium as a version of spinach that was more recent, which is amazing. I mean, we're deficient in minerals, and that leads to the accumulation of heavy metals, correct? Like whatever valence was supposed to be holding that mineral, if it's not available, can bind onto a metal, not really knowing the difference. It's kind of like if it's like an ionic charge thing. It doesn't have that's a mercury and this is a magnesium. All it knows is that chemical valence is the same, and it'll hold on to it. And we accumulate these toxic metals, which, there's plenty of research to show what these things do to your mental health. For instance, with mercury has been shown to basically dysregulate how glutamate works. And glutamate being the most excitatory neurochemical in your central nervous system, when you've got too much of that, it is a contributor for psychosis. And we've seen, one of the things that I've seen just over and over and over and over again, and we're waiting for our enough of a data population to actually prove the efficacy of pulling heavy metals out of people. But there's this phenomenon that I've seen over and over and over again. A person comes in, they've had a level of anxiety that's kind of come up on them gradually, and then now it's presenting as a constant anxiety. It doesn't come or go. It's not associated with interdosing withdrawal. It's not associated with situational anxiety. It's as if they're standing in the middle of a freeway. They've got anxiety, they can't sleep, and they have this ruminating fight or flight, am I going to die? Am I going to die? Am I going to die? Sort of thing. And it never shuts off. And then I look in their mouth and whoa, you see all this mercury in their mouth.
Amalgam fillings.
And and I see it in younger people, especially people that are coming from foreign countries. But I mean, I've seen kids in their 20s that are still getting mercury fillings and having this phenomenon. And I've thrown everything in the book at them. And the only thing that's worked for that population is getting the mercury out of their teeth and actually putting it in a chelation program. Have you seen anything similar?
Oh my gosh, 20 years of it.
I'll bet.
20 years of it. Everything that I do in my practice, because I do a lot of different things, I would say by far chelation therapy has been the most powerful. Because the first R of functional medicine is to remove, then replace, reinoculate, and repair. How can I repair the system? How can I repair the brain if the patient is struggling on a daily basis with heavy metals such as mercury, lead, aluminum, cadmium, nickel, gadolinium, right? And we're, like you said, is minerally deficient because of our soil. And we're not able also to excrete these heavy metals properly, so they get accumulated. Now, I have seen an unbelievable pattern in my practice that these patients are walking around with these amalgam fillings or heavy metals in their systems, hunky-dory, no problems, right? For years, they're able to tolerate this level of toxicity. But then something happens in their life, either gastroenteritis or a viral infection or a stressful event or loss of a loved one or loss of a job. Something happens to them that all of a sudden, it was like the straw that broke the camel's back, right? So it makes their gut leaky, and that leakiness in the gut causes all the heavy metals to leak out from the cells into the bloodstream and go into the brain. So all of a sudden, they become foggy. They can't think clearly. Their memory gets affected. They have muscle ache. They have extreme fatigue. They have digestive issues and bloating, constipation. I mean, the list goes on. Anxiety, severe anxiety, like you said, depression, joint pain. I mean, the list goes on, right? So what do? We build up their gut a little bit. I usually give colostrum and glutamine. I also have a test for leaky gut, by the way. It's by Cyrix Laboratory, and it's called Array2, which measures the antibodies that, if those antibodies are elevated, that means that the gut junction has become leaky.
Right.
So we test for that, and then we hit them with colostrum, glutamine, bone broth. I also do high-dose vitamin C therapy because that also will help bind the lining of the gut with glutathione. Now, in a way, I'm kind of hitting several birds with one stone, right? Not only am I healing the leaky gut, I'm also building up the level of the neurotransmitters in their brain with that high-dose vitamin C. I'm sure you're familiar with the work of Dr. Linus Pauling, who won a Nobel Prize, right? Because giving them that high-dose intravenous vitamin C, like 15 to 25 to sometimes 50,000 milligrams of vitamin C, is going to build up those neurotransmitters, and it's a very powerful antioxidant. So the oxidation we were talking about at the beginning of your show then goes away, and then we're going to have this level of antioxidant with high-dose vitamin C and glutathione. So we're repairing the brain at the same time we're repairing the gut, right? Then once I feel the patient is strong enough, I will provoke them with DMPS, which is a chelating agent that goes after mercury and tin. I always follow my chelations with IV glutathione. Do not let anybody, I'm talking to your listeners, please do not let anybody chelate you without getting a dose of IV glutathione, because glutathione will prevent remobilization of these heavy metals to other areas of your body, and it will help kick out the heavy metals that have already come out with the chelation. And
remineralizing them after, right? Do you do a remineralization afterwards?
So what I do, remember we've talked about this, you and I do remineralization with concentrates, which is a trace mineral, which is very powerful. I also, after 3rd, 5th, and 10th chelation, I give them a vitality prep, which is full of trace minerals. So I'm constantly remineralizing them in between chelations, right?
Now, you said between how many?
I'm sorry?
Between, what is the space in between the chelations that you do the remin? How many?
After 3rd, 5th, and 10th chelation, I remineralize them. But don't forget, you're right, but don't forget, they're also taking their trace minerals every day, except chelation day. There's no point to take it on the chelation day because it also causes competition with the chelating agent. I want the chelating agent to go after them.
Right.
Then I have another type of chelating agent called caffeine.
If you're taking the minerals the same day as the chelation, then the chelator is just going to pull the minerals. So you restrain that
Not
day
only
of
that,
the chelation.
yeah, trying to pull it out, right, but it's also going to cause competition. So because the chelation would rather go after the minerals than the heavy metals because of the ionic bond that you were mentioning earlier.
Yeah.
Right? So then the other chelating agent that we use is calcium EDTA, which goes after lead, aluminum, cadmium, nickel, gadolinium. And that one is also very powerful. Patients who have been around construction sites or painters, or people generally from back east actually have a lot of lead in their system. And we see mercury more on the west because they like to eat sushi, high mercury fish, and their mouths, like you said, are full of amalgam fillings, which sometimes I just want to scream, because grinding and chewing and drinking hot fluids, guess where all that mercury vapor goes? It goes either into your brain or into your thyroid tissue.
Well, you remember back when they were putting thimerosal into vaccines, it wasn't, the real purpose of that, as I've been told, was as a bacteriostatic agent. So it could kill off the bacteria so that they could use multiple dosings out of the same bottle instead of having individual dosings, which would have cost them more for each little bottle. But somehow they were putting this most toxic natural occurring compound into vaccines to kill off bacteria. Well, if it's in your teeth and you're chewing it and it's getting into your gut, wouldn't that just kill off your microbiome?
100%. 100%.
Yeah,
I told you. Yeah, most of these patients have leaky gut syndrome. Because these heavy metals, not only are they killing the microbiome, most of patients are also developing SIBO, small intestinal bacterial overgrowth, because their gut motility is getting affected by these toxins.
Mm-hmm.
You see what I mean? One of my goals actually is to get into some research and figure out if SIBO is related to heavy metal toxicity. Because as soon as I pull these heavy metals out of my patients, their SIBO resolves. Bloating goes away.
Yeah, I've seen people come in with, they've been on a candida diet for 3 years and they still cannot create a healthy microbiome, and they've got mercury. Then you pull out the mercury, and then suddenly their candida goes away. So something has to be connected there. I've heard that the funguses actually, they don't like the mercury, but they can endure. They have a certain mechanism for enduring it. With their billions of years of evolution, they've learned how to metabolize the mercury a little bit better than the bacteria, and they methylate the mercury, which makes it more toxic to the human and less toxic to them.
Correct. I'm so glad actually you brought up the issue of candida, because a lot of SIBO can also be related to overgrowth of fungus or yeast.
Mm-hmm.
Now, many of these patients are struggling with chronic yeast infections or chronic bacterial vaginosis. I've seen that in women, or chronic toenail fungus. And all of a sudden, as we chelate them, their yeast infections go away, bacterial vaginosis goes away, toenail fungus resolves after 20 years, right?
Mm.
So I'm going to explain to you the mechanism. Heavy metals cause biofilm formation around yeast or bacteria, right? So this biofilm formation is almost like a hard shell that's difficult to crack. So no matter how much diflucan you take, you're not going to be successful. So I tell my patients, please leave the yeast alone, because I don't want to cause more resistance, right? Let me chelate you, and then we're going to attack the yeast. But most often, the yeast is going to go away after I pull the mercury out. Do you see what I'm saying?
Yeah, truly.
That's why I like to do the remove part of the protocol first, then do the, re-inoculate and the repair of the organs. because once you remove all these toxins, a lot of the pieces of the puzzle just falls into place.
Yeah, I mean, it's no different, I imagine, than soil. If you've got poisoned soil, you're not going to be able to grow a plant on it. You got to get the poison out of the soil before it's viable to even, to be an environment for a plant to grow on. And another way I kind of frame this up in my mind is when it comes to toxins. I mean, what a toxin does is it poisons normal physiology. So there's a normal physiological function, like let's say how hemoglobin binds to oxygen. It's a light bond. So we breathe in oxygen, it binds to it, and then it lets it go because of a certain pressure differential within our bloodstream. But carbon monoxide doesn't do that. Carbon monoxide will bind to that hemoglobin. The oxygen's not allowed to bind, and the person will go into oxygen starvation and die. Even though there's still plenty of oxygen in the room, even though that nutrient is still in the room, they can't utilize it because it's already occupied by the carbon monoxide. So you have to get that carbon monoxide off of there before they can even utilize the nutrient, the oxygen. It's the same way with the heavy metals. It's the same way with all the poisons. You've got to actually clear that out because usually they're over-competing the normal physiological function in order to be able to do their destruction. Yeah. And with brain chemistry, with brain chemistry, like comparatively speaking, a cell is more like a tank, whereas the neurochemistry is more like the water that the army drinks. You can poison the neurochemistry a lot easier because it doesn't have as many defenses towards it. It's a chemical organ. It's using that chemistry in a pristine way. And if it's all, toxic up, you're not going to produce your serotonin well. You're not going to break down your dopamine well, or whatever the neurochemical function is. So I think the neurochemistry is even more impacted by these poisons at times than the actual physiology. By the time you see gut lining breaking down, I mean, you've got all sorts of chemical changes happen in your brain that's messing things up in the way you sleep and the way everything's regulated.
Right. Also for your listeners who like fish, okay, I'd like them to know that there is high level of mercury in tuna, king mackerel, sea bass, cod, catfish, orange roughy, and swordfish. So they really need to be careful because I've seen accumulation of mercury in these patients, even though they haven't had amalgam fillings in their teeth. Mm-hmm. They're just frequent fish eaters and they love fish. And
farm-raised salmon. And farm-raised salmon as well.
And farm-raised salmon, yes, absolutely. I mean, farm-raised salmon has a lot of other chemicals as well.
Yeah, they're feeding these farm-raised population already toxic fish, and they're taking in a poison that they can't let go of. It's kind of like if I give you $5 and you can only spend $1, and I keep giving you $5 really fast, you're going to accumulate a lot of money. They're going to accumulate a lot of mercury because you're feeding them something that's already poisoned that they physiologically don't have the ability to get rid of. And so the buildup of that in their system is a logarithmic curve rather than just a linear curve. It's the bioaccumulation can be very impressive. I've heard that even 1 8-ounce fillet of swordfish given at the right time could permanently impair the fetus, an unborn child, and a pregnant mother and actually mess up their nervous system in a way that that's irreparable.
Yeah, I mean, the rate of autism has gone up astronomically since the 80s. And even though they say they don't see a connection between mercury and autism, I really doubt that. Because I see the younger population now a lot more toxic with mercury than the older generation. And I see it. I've seen the pattern in my practice. I'm happy to report that some of the OBGYNs in the area are referring patients to me for chelation therapy before they freeze these women's eggs or before, they get pregnant. I also encourage my patients who want to get pregnant, give me 3 to 6 months to chelate you, and then you can get pregnant because I'd rather those heavy metals not to go into the child's brain I have twin girls who are 9.5 years old. And I'm very lucky because I finally decided to test myself, to chelate myself. So before I got pregnant, I tested myself, and mercury level was 57. It should be less than 4.
Hmm.
And
Was
I
that
did
a
about 15 IV.
Was that a blood test, or was that was that the blood test
No,
or
it was
urine provocation?
I'd like to explain the difference, the blood test and the urine provocation. It
Please.
was a 6-hour urine provocation.
Mm-hmm.
The reason I don't bother with blood tests or a hair mineral analysis is because it shows what's already been excreted into the blood and into the hair. It doesn't show what you're storing at a cellular
What you're holding
level.
on to, and that's the important part.
You're holding on to. It doesn't show what you're holding on to into your brain, right? So I actually have to provoke the patient with a chelating agent, and then they go home and collect their urine for 6 hours. That's when I'm going to see how much they're excreting into their urine, because that provocation, the chelating agent, binds to the heavy metals and pulls it out into the urine. You see that? So,
yeah,
and I do it 2 different times. I do one with DMPS and 6-hour collection, and I do one with calcium EDTA and 6-hour collection. Some doctors like to mix these, chelating agents, but they give half of DMPS and half of calcium EDTA. I like to give the full provocation when I provoke my patients.
And this is why I like to send patients to you, because the chelation in itself is an art. You know, if a person's testing, like you said, the hair, you're already seeing what physiologically they have the ability to excrete, because it's like an excretory organ. So you could see a lot of mercury in somebody's hair, and their physiology is working fine because it's getting rid of it. When you have it in the blood, it's like, okay, so you're seeing it in the blood. It's only showing you current exposure. It's only showing you the last 90 days at best of what a person's been exposed to. But what I've seen in the chelation is back 13 years ago, when I was, well, I'm still naive in many things, but naive about this particular thing then, was that we thought that, well, we'll test people in the beginning. On week 1, we'll show their heavy metal levels, and then we'll test them again week 8, and we'll show that it's reduced. Wasn't even close. It was exactly the opposite. On week 1, we showed nothing. We would have got a false negative on these folks, believing that they didn't have anything. We had to actually get them mineralized up enough, get their glutathione levels up enough, or whatever, basically get their physiology, their detox physiology working, so that they could excrete this in the first place, and then get a good test on them. And a lot of times I've seen negative tests that I know there's a problem in there. And so we keep building them up, we keep building them up, we keep building them up. And then we do it again, and boom, it's just like the confetti falls from the ceiling. It's like, it's in there.
That's a very, very good point you're bringing up, Lyle. Also, obese patients or overweight patients, sometimes their tests are negative because the heavy metals are hiding in their fat cells. Mm-hmm. And then after we help them lose some weight and we retest them, their heavy metals are really high. One of the reasons patients gain weight can also be toxicity.
Oh yeah, their body's trying to. Their body's trying to.
Is really,
their body's trying to find some place to put all this stuff.
Right, your fat cells are trying to protect you against toxicity, protect your organs against toxicity. So you're holding on to the fat to protect yourself. So going back to myself, I did 15 chelations about 10 years ago, brought the mercury level down to 9, and I just rechecked myself recently, and it's still down, it's still low at 9. So, just so that your listeners can be encouraged, chelation therapy is not something you have to do over and over again. Once you get it out, if you stop the exposure, then you would be good to go. I mean, once in a while, you want to check yourself. Like, I had no symptoms when I checked myself. I was just curious to see if my levels had gone up again. So, but I'm very careful with the type of fish that I eat. And obviously, all my mercury is out on all the the metal crowns are also out. Even though they don't have mercury, they have nickel in them. Mm-hmm. So. That's
Yeah,
an area.
I actually used to be, when I was doing speaking engagements, one of the committees I found myself on was a mercury-free dentist panel. And do you remember Hal Huggins?
Oh yeah,
Yeah,
absolutely.
he was part of the panel. And so I'd get to hear from these dentists, biological dentists, all of the things that they had seen. And it was amazing how much it correlated up to what I was seeing in mental health. I was the only non-dentist on the panel. It was 3 dentists and me. And yeah, and
I
when I see that patient, the supplements are going to bounce right off of them that I have. The mercury is, it's like bouncing ping pong balls off the Berlin Wall. It just, oh, can I take a theanine or a passion flower? No. I mean, you can. It might have a modest effect, but the tryptophan is just not going to. I think it poisons serotonin, because they have all the
100%
hallmarks.
it will. Absolutely it will, because most of these patients who have mercury toxicity have depression, anxiety, brain fog, memory loss.
Yeah, and when I try my normal tricks for building up serotonin, it doesn't work.
Yeah.
Some people even have a paradoxical reaction to that. And I tell them realistically that this is going to take 6 months for you to get enough of this out of your system to find the relief that you can really, sort of exhale into. And that's a hard conversation to have with someone who is in immediate panic full time, because everything is, tomorrow is too long, So do you see any advancement in the things that you're doing? Do you have a time frame for people to come out of the rafters that you kind of brace them with?
Sure. I mean, the reason this conversation becomes a little bit easier with these patients is because generally after the first provocation, they feel better.
Mm-hmm.
They come back for follow-up to go over their test result and say, I can't believe my brain fog has lifted. These are patients who've suffered for years, and one IV chelation has put a dent into their symptoms, right? So then when I go over the toxicity screen and I say, listen, your mercury level is, let's say, 70, and you're going to need a minimum 10. It's a minimum, because after 10 chelation, I usually like to retest. They sign up right away. They want to chelate because they already have felt better after one chelation.
Mm-hmm.
So then generally after 3rd or 4th chelation, these patients start feeling a lot better. And they're just motivated. Some want to come in here twice a week to chelate. And I tell them, if you can tolerate it, it's totally fine. Make sure you take your trace minerals every day except chelation day. And I also don't want them to do any extracurricular, I call it extracurricular activities for chelation therapy, meaning I don't want them to do infrared sauna. I don't want them to do spirulina. I don't want to mobilize these heavy metals in any shape or form in between chelations. Chelation is very powerful. It's going to pull it out. Mm-hmm. So there's no need for them to do anything at home. Just the trace minerals. Just remineralize yourself in between chelations.
Okay. Now, as you know, we have a sauna program that we put, I think you know this. We put people through a sauna program, and at best, we chelate them every couple weeks. We give them a little break in between the chelations. They're also going through.
So I love the sauna program. Yeah, I love the sauna program. So it's fantastic because all the stuff that can come out through the skin, like all the chemicals they have absorbed, not necessarily heavy metals, because heavy metals, they've done sweat studies. It doesn't come out in the sweat.
Very little. I mean,
you actually have to do chelation to pull the heavy metals out if you want to be very effective. But the sauna program is fantastic, right? Because you're pulling all the other chemicals, pesticides out of their system. And can you talk a little bit about that in terms of if your patients are having mental clarity after they do the sauna program?
Oh yeah. Yeah. Um, so we get a mix of people across the strata of mental health problems, everything from
Yeah.
psychosis to anxiety to depression to um, people who don't want to be there. Their parents are making them be there, kind of thing. And there's definitely a
Yeah.
difference between the people who do the sauna program and the people who don't. There's people that have come in with
Yeah.
diseases I have never even heard of until they showed up. Collagen, genetic collagen disorders. Um, I remember I got 3 Tourette syndrome people all at the same time. I'd never seen a Tourette's patient before. And seeing these things clear up from them dedicating themselves to that. I don't know exactly why or how, but it does. And the sauna is set up to be a biotransformation process. It's really to ramp up and sort of phase match their, phase 1 and phase 2 detox, and then also provide them with things so they don't reabsorb it. So it's really trying to ramp up the elimination of organic poisons and solvents. It's not that particularly effective at heavy metals. I mean, over a few years, yes, but people want relief now, and the chelation we found is a way to cut that a lot quicker because it directly goes after the heavy metals and pulls them out.
Correct.
There have been some sweat studies that I thought were kind of interesting. People will sweat out cadmium at even a higher level than they'll urinate it out, but it still isn't really enough to put a dent in a substantial heavy metal burden as a
Couple
standalone.
of other things about the sauna program. One is that it boosts up the metabolic rate, so it's great
Mm-hmm.
for weight loss. The other is that phase 1, phase 2 detoxification pathway that you're mentioning is very, very important. So for your listeners, I want to mention what that is. In phase 1 of the liver detoxification pathway, most of these toxins are fat soluble. So in order for them to become water soluble, so you can pee it out or you can excrete it in your stool or even in your sweat, it has to become water soluble.
Mm-hmm.
So glutathione is a fantastic way to add that sulfur group and make those toxins actually water soluble. And like you said, the sauna program also enhances that phase 1, phase 2 detoxification pathway of the liver.
Yeah. Yeah, we're doing kind of the orthomolecular, you mentioned Linus Pauling. There's high dose niacin, high dose vitamin C. The flushing, combined with the
Yeah.
exercise helps a lot. The niacin will bioactivate in many ways the phase 1 process. And then, like you said, the conjugators like sulfur or methyl groups and that can help neutralize it and let you get rid of it.
Mm-hmm.
And that just does so much for a person's physical and mental health. It's ridiculous.
It's awesome. I actually love infrared sauna, and I use it quite often myself.
Yeah, we've got both. We've got one of them that gets up to 200, and that's the one that people like the most.
Wow, that's awesome.
Hot.
I have to come and visit you guys.
Hey, we're here. We're here. I mean, we're really the only place that has been exclusively focused on psychiatric medication withdrawal that has been licensed.
I love it.
16 years now. And
I love it. You do great. You really do a great job, Lyle, because you're so insightful. You're so aware of the patient's physiology, and you're so knowledgeable. So I have so much respect for you, and I thank you for the type of work that you do with these patients because they really need it.
Yeah, I mean, when somebody's in that sympathetic overdrive from excitotoxic poisoning, there's no way to talk them out of that, and it's and what's really sad is we don't make any money doing this because the insurance companies are going to pay for therapy and medication management. That means for a PHP program, that means that 6 hours of your day has to be dedicated to, sorry, I'm bound up in my cord here, talking about what's going on. And even though we do need to talk about what's going on, especially when you're going through a detox process, all of those emotions that were paved over by the medications are going to come up. Where does that leave time for you to address the physiological part? To go to the gym, to work the sauna program? All of those things are not reimbursable by insurance And you need to try to fit that in on top of the 6 hours that you're doing therapy. So what happens? The insurance company says, oh,
Please
we're not going to pay for that.
Don't get me started on insurance companies, because that's very like, yeah. Don't get me started on that subject. It's pretty bad what's happening out there, because these patients are paying a lot of money for their insurances, and they have high deductibles, and then none of the work that you and I do is covered by insurance. That's sad, because this type of work.
What's even worse is they'll say they're going to cover it. They'll give them the authorization. They'll come to treatment, and then they won't pay for it. And we end up holding the bag, because we're not going to kick them out of treatment once we've started. We're not going to say, oh, we're sorry, your insurance didn't pay. There's the bus stop. You know, I mean, they might get less things, but we're still going to push them through the program. Yeah, we got a clawback. We got a clawback from one of the insurance companies that said that, just to go into it briefly, just how bad it is. So we're a residential facility. We're providing residential 24-hour care. And we get paid from the insurance companies for that. Well, when they step them down to a lower level of care, we're not going to just put them in a house, you know, somewhere in the community and say, well, you know, come in for a few hours a day and talk about your situation. We're all encompassing diet. You know, we're still working with their medication withdrawal through the process, which could have, you know, emotional upset any time of day or night because of the withdrawal. There's no way that they're really an outpatient candidate. But then they start paying us, you know, $200, maybe $300 a day for this outpatient care, and we're still providing residential care. I mean, that's the $200 to $300 a day is the cost of an Airbnb in Sedona, right? We're providing them 20. So we got a clawback because we were giving them residential level care for outpatient, and they said, well, we're not going to give you any of that outpatient money then.
Yeah.
And send us a bill for $300,000 for like 5 years worth of it. And we're like, really? We treated your patients. You authorized the level of care. It's really about money for them. It just is.
So I've always told my colleague that doctors, physicians, we need to have our own union, and we need to fight back. But we are so busy taking care of patients that we can't go after these insurance companies that are underpaying doctors who are really healing these patients. This actually, it's gonna, in the long term, you're saving the system millions of dollars by getting these patients well.
Yeah, they don't have the resolution knob to see that. We've gone round and round with them. I mean, we've taken 87.5% of their patients off of medications, got them out of the mental health system, which I'm sure has saved them millions and millions and millions of dollars when you rack that up against thousands of patients. And still, they're blind to that because, you know, and mental health and addiction is probably about less than 10% of what they're reimbursing anyway. So it's sort of like, yeah, it's not important to them.
Well, it's so nice to be on the show. Do you have any other questions that you want me to answer for your listeners?
Well, I would like you to give us the name of your practice, how people can contact you, you know, your website address and your office phone number, if you would.
Sure. So the name of my practice is Health and Vitality Center. The website is drshiva.com, which is DRSHIVA.com. And the phone number is 310-477-1166. If you guys have any questions, you can also email me, drshiva@drshiva.com.
Well, thank you for doing what you do. And we'll keep sending our patients to you for ongoing care so they can get good follow-up and not fall between the cracks again. Thank you
So much.